The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
A woman should start getting her mammogram by the American Cancer Society recommendation at the age of 40. Now, that's the average woman that does not have any family history of breast cancer, and those are significant family members like a mother, a sister, and even when you think about grandmothers and aunts. There are also women that don't have any family history of one of the more unusual type of genetic disorders. So beginning at 40 is the best time. It's an annual mammogram. It continues on and throughout your life. We used to stop at 80. Now we continue on until the latter part of a lifetime span. When a woman comes to have a mammogram, there are two types that are currently performed in the United States. One is called film screen, and that's like a photograph, like when you used to take a camera with the 35 millimeter, you actually have a printed image. The other way is called a digital mammogram, and about half to 75% of our facilities now in the country are digital. Not everyone is digital, so a lot of people assume that it's called a digital mammogram. It is still a technique that requires radiation because that allows us to penetrate the breast. So the breast is held in two different positions. One of them is to the side, one is from top to the bottom. It is light compression, the idea being just like a photograph, if you move, you blur the image, and therefore it degrades the image. So the patient needs to really be still, you hold your breath, you have that compression, and then the picture is taken. The technologist then looks at the image to make sure that it's okay. That's why she says she wants to check the image, because again, motion or contrast could all make that image not acceptable. So that's called a digital mammogram. A woman should get a mammogram every year. There is a lot of talk in the literature, there's a lot of talk on the radio, on the news that says that a woman should start at the age of 50 and have a mammogram every 2 years. There is no data to support this. All the data and all the research that's been done in the United States and around the world support that screening mammogram beginning at the age of 40 every year will save your life. Anything that deviates from that is not going to be what we consider the standard of care. So I do absolutely urge everyone every year. The current role of self-examination with a mammogram is kind of split. Beginning with self-exam is really the young patient starting around the age of 20 to 25. And again, this is someone who doesn't have a family history of breast cancer, and I'll talk a little bit about that in a second. But that is a yearly breast exam by your clinician, and then self-exam monthly. I believe, and this is still controversial about how important or how useful it is, that every woman should know what her breast tissue feels like. She'll be able to tell a change in her breast tissue from month to month. So learning to do a good breast exam from your clinician is very important. That should be monthly and should continue on throughout your life. Now, in terms of what do I do if I have a high risk, when do I get my mammogram, when do I do my self-exam? Let's, for instance, say you have a family history of breast cancer with a mother at the age of 40. You should begin your mammograms at the age of 30, so 10 years prior to the premenopausal, which means before their periods start, or age 50, that patient should start having her mammograms 10 years before, and again, clinical breast exam every year and a self-exam every month.
We hope you'll join us for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.